Good morning and good afternoon, everyone, and thank you for joining us for our session today. My name is Olivia Marquez, and I'm a research coordinator with Health Evidence. I'm also the research coordinator for the KTA Cancer Prevention Study. It is my pleasure today to welcome you to our monthly webinar series. And today we will be discussing menu labeling for reducing energy ordered and consumed. What's the evidence? So that's a welcome to our regular Health Evidence users, as well as our KTA participants. So throughout the session today, we will be posting polling questions through WebEx. Your participation in polling questions is voluntary and anonymous. We hope to enable engagement and stimulate discussion throughout the session. So I'll just leave this consent slide up for a moment, and then we'll move on shortly. Okay, so just to let everyone know that after today, the PowerPoint presentation and the audio recording will be made available through Health Evidence's YouTube and SlideShare account, usually within the next week. So the links to those resources will be posted in the chat section. We're very excited today to be talking about this systematic review. Menu labeling is effective in reducing energy ordered and consumed, a systematic review and meta-analysis of recent studies. So the link to the Health Evidence Review page for this systematic review will be posted in the chat section. And you can also follow along and click on the PubMed link out in case you want to follow the review as we go through today. So just a few housekeeping items before we begin. Please use the chat section in WebEx to post any of your questions or comments. We ask that you please send your questions or comments to all participants and not just to the host, but we will see it either way, so not a problem. You do not need to wait until the end of the session to post any questions that you might have. You can do so as we're going through. For the best connection today, we recommend you use a wired internet connection versus wireless. And should you have any issues, we've posted the WebEx 24/7 helpline. So again, that phone number will be posted in the chat section as well. For your audio today, please listen through your speakers. You can go to Communicate at the top tab in WebEx, and then click Audio Broadcast. So we have our first polling question of the day, and we're wondering how many people are listening to today's session with you. If you're joining just yourself, 2 or 3, 4 to 5, 6 to 10, or over 10 other people with you. So you can please respond through WebEx and then just make sure to click Submit when you've responded. So thank you to those who have responded. We're seeing that most people are joining by themselves, and a few who are joining with 2 or 3 other people, which is really great to see. This is a special thanks to our Health Evidence team who brings you this monthly webinar series. There's a large team of us who help to keep Health Evidence current and maintained, as well as coordinate the monthly webinar series. So for those of you who may not be familiar, Health Evidence is a service and research organization involved in knowledge translation for public health professionals. Our main product is our registry of systematic reviews, where we provide over 5,000 quality-rated systematic reviews that evaluate the effectiveness of public health interventions. So the value added with Health Evidence is that we save you time. We've done the work to screen and appraise each review within our registry. We screen all reviews for relevance to public health and keep our repository up to date by constantly screening relevant databases. At any given time, we're about no more than 1 to 2 months behind the publication date. So we've done the work for you by critically appraising all reviews within the registry by using a transparent process whereby you can actually click on the full quality assessment for each review and see our rating based on our 10 assessment criteria. Healthevidence.org also has various tools and supports for evidence-informed decision-making available online. And throughout the years, many users have informed us that they find the website easy and simple to use. So I'm just going to put up here the model for evidence-informed decision-making, which we can keep in mind as the presenters go through their systematic review today. So this model for evidence-informed decision-making in public health consists of 5 components that you can see in the diagram. So traditionally, public health practitioners and decision-makers consider evidence about community health issues and local context, existing resources, and community and political climate when making decisions about programs and policies. However, it's become apparent that considering evidence about research may be more challenging. So as such, the Health Evidence webinar series is designed to identify research evidence relevant to public health decisions. So here we can just see the stages of evidence-informed public health. This wheel is a guide for practitioners and decision makers to determine how to address particular issues by systematically incorporating research evidence into the decision-making process. So there's 7 steps outlined here, and today we'll learn about how our presenters have worked through the first 4 steps in order to help with decision-making with the remainder of the 7 steps. So we have our second polling question here, and we're wondering how many of you have heard or are familiar with PICO-S. So again, please respond through WebEx, and then just make sure to click submit when you've responded. So we're seeing about a split, a few more who have heard of PICO-S, but a few who may not be familiar. So please, you can continue to respond as we go through. So for those of you who aren't familiar, PICO-S is a way to structure your questions in a defined set of EIDM. So it involves defining who the population is that you're interested in, what the intervention is that you want to know, or program or service, the comparison group, if any, and the specific outcomes that you're looking for. So sometimes we also have a particular setting in mind, which could be school or community setting, for example. So the value of a PICO question is that when you have an issue that arises, you can use PICO to turn this into a searchable question, which allows you to further articulate specific components of the question and then helps you to hone in for searching. That way, when you're searching for relevant information, you can makes it quite a bit easier and quicker to identify relevant literature. So we're moving on to our third polling question today, and we're wondering how often you use systematic reviews to inform a program or service. So it might be always, often, sometimes, never, or you might not be familiar with what a systematic review is. Great, so we're seeing quite a few people who are actually often using systematic reviews to inform their decisions, which is really great to see. And a few others who are sometimes or always. We just have one more question before we move on today, relevant to the topic. So before you hear from the presentation, we're wondering your agreement with the following statement. Menu labeling can reduce energy ordered and consumed in the away-from-home food environment. So you can select your agreement with that statement. And I'll leave that open for just a few more moments, and we'll move on to introduce our presenters today. So we're really excited to have Sofia, Lourenço, and Jodie Littlewood, who are the authors of this systematic review with us today. So without further ado, I'll pass it along to Jodie and Sofia. So thank you very much for joining us today.
Hello from not-so-sunny Copenhagen. My name is Jodie Littlewood.
And my name is Sofia Lourenço.
Thanks, Olivia, for the introduction, and also thanks to Health Evidence for this opportunity. We're delighted to present our research on menu labeling to you today. In all, there were 4 of us contributing to our article. Myself and Sofia were the lead authors, and were responsible for the design of the study, while Cecilia helped out with the statistics in the meta-analysis, and Gitta provided critical guidance throughout the whole process.
So why does the Danish Cancer Society even work with menu labeling? One of the main pillars of our work is cancer prevention, and we work both in the form of public-oriented campaigns, public-private partnerships, cooperation projects, and so on. but we also lobby for effective new initiatives when the evidence for them is in place. And as we know, overweight has a number of consequences that lead to several non-communicable diseases. Among those, overweight is a risk factor for several types of cancer. At the same time, overweight has been steadily increasing in Denmark. Data from the Nordic Monitoring System project from 2016 shows that 47% of the Danish population is overweight, and of these, as many as 15% are obese. These rates are not as high as other Western countries, like the UK or the US, yet. But if we don't take precautionary steps, we could easily reach an overweight rate of 70% in the next 30 years, and end with a national status similar to the one we see in the US today. And this is why we are interested in menu labeling at the Danish Cancer Society. We wanted to research whether it is effective in helping customers reduce the amount of calories they consume. We have followed the development of menu labeling for some time now, and Jodie has previously carried out a systematic review of studies spanning from 2005 to 2012. The inclusion criteria were limited then to studies being carried out since the implementation of menu labeling in New York City to better align the study designs and menu labeling formats used better reflecting the regulations.
And for those of you who are not familiar with menu labeling, it quite simply is the prominent display of calorie counts on menus, menu boards, or food tags, for example, so they are visible at the point of purchase. What is important is that the energy value clearly relates to the menu item and its respective price. To help consumers put this energy value into the context of a full day's energy requirements, reference values should also appear on menus, and they say something like, the average adult requires approximately 2,000 calories a day. From a public health perspective, there is great logic behind menu labeling, and there's many reasons why it should be considered an important element in obesity prevention, especially if we consider the changes over time in food availability and the increased reliance on foods prepared outside the home, which has been linked to unhealthy weight gain. This list provides an overview of the rationale behind menu labeling, and I'll go into detail of each of these points listed here in the next few slides. People are eating out more often, and this could reflect our busy lifestyles and the convenience of eating relatively cheap fast food, or in other cases it could relate to increased disposable income, allowing some people to dine out more regularly. In any case, more and more calories are coming from foods prepared outside the home, and this corresponds to an increase in proportion of our food budget being spent on eating out. Over the years, we've seen a considerable increase in the number of food establishments serving us, and now, in many cases, 24 hours a day. Not only do we eat out more often, but foods prepared outside the home tend to be more calorie dense and are served in larger portion sizes. Children's meals can contain twice as many calories when eating out compared to home cooking, and people can consume a whole day's worth of calories in a single fast food meal. What's really alarming is a single drink can also contain 2,000 calories. The problem is people have no way of guessing how many calories are in a menu item, and studies show that we drastically underestimate the energy content of meals prepared outside the home by approximately 25%. The degree of underestimation, which can exceed 600 calories, becomes greater as calorie content increases, and it's particularly common if menu items are perceived as healthy. Few would guess that a salad could contain as many calories as a regular burger, or that a green tea could contain 1/4 of all the calories you need for an entire day. It's easy to be complacent about calories when you're out and about, and some snacks may be considered inconsequential to your weight, not realizing that a bucket of popcorn can contain the same amount of energy as 4 cheeseburgers. Some have found that menu labeling has both a salience and a learning effect. That is, the mere presence of menu labeling actually increases the importance of considering calories when making food choices, and it also means that people learn the calorie content of their regular choices. We'd like to think the effect of menu labelling could be described as calorie enlightenment, where consumers can exercise personal responsibility and make informed food choices when calories and reference values are posted on the menus. Menu labelling helps consumers see the calorie information. Prior to menu labelling, nutrition information was provided by some food chains on pamphlets or food packaging, for example, but it was not readily or consistently available at the time when people were making their food choices. When menu labelling is compliant, that is, when energy values are clearly labelled, typically 70 to 80% of customers see the information. And this contrasts to the small fraction of customers who seek nutrition information when calories are not on the menus. Portion sizes have increased 2 to 5-fold over the last half-century, and people are enticed to purchase more through the economic incentive to upsize or supersize, which can double the calorie content of a typical burger meal. But menu labelling can deter this passive overconsumption by making the caloric consequences of these value for money offers more obvious. It's reasonable to expect that menu labelling could be effective by a second mechanism. That is, it could encourage product innovation where the food service industry reduces the calorie content of their menu options, especially if consumers demand it as they become more aware. Here's some examples of caloric savings as a result of product innovation, including changing default options. And these energy reductions are meaningful and could avert weight gain for regular customers. Last but not least, consumers want menu labelling. National surveys indicate that consumers overwhelmingly support calories on the menu, while a global survey with 25,000 respondents from 56 countries revealed that 80% desire menu labelling.
And now a little about our methods. Our aim was to provide an update of the most recent evidence of the effects of menu labelling on energy consumed, energy ordered, or energy selected in both real-world and experimental settings. The review also assessed the importance of noticing menu labelling and menu labelling format. Even though we don't describe it in our paper, you can see that the format of the review follows the PICOS structure neatly. We conducted the systematic literature review in 2014. We included peer-reviewed full-text articles published in English. They had to be primary studies, comparing the absence of menu labeling with the presence of menu labeling. And the effect of menu labeling had to be quantified in terms of energy consumed, ordered, or selected in either kilojoules or calories. For the sake of this study, we defined energy selected as hypothetical choices or intended purchases. No purchases were actually made in those studies. We defined energy ordered as actual food and beverage items ordered from a menu, while energy consumed measured how much participants actually ate from their meals. An interesting criteria relates to the narrow inclusion date, as we only included studies published after 1st January 2012. There's a good and simple reason for this. As I mentioned previously, we've been following menu labeling closely for a few years, and the one thing that stood out was how the effects of menu labeling improved over time. So we made an attempt to capture results which we believe more accurately reflect consumers' response to menu labeling, knowing that consumers were growing more accustomed to it, and also that industry compliance to either legislation or voluntary agreements was becoming more widespread. The online search identified 141 articles, of which 15 were retrieved for full-text review. Of these, 3 studies considered the effects of menu labeling on energy consumed, 6 studies reported on energy ordered, and 6 studies assessed the effects of menu labeling on energy selected. In all, 7 of the included studies were conducted in real-world settings, compared to 8 studies conducted in experimental settings. we found 8 studies reporting the rate of participants who actually noticed menu labeling. And finally, our review included 10 studies not previously included in other reviews. After identifying the 15 studies that were included in the review, we applied a structured approach to extract relevant information from each of them and conducted systematic across-study comparisons based on a matrix including these details: year and authors, country, origin, aim, study design, sampling, setting, the type of outcome reported, possible covariates, results, and limitations of their design. We developed our own quality assessment scheme, incorporating standard rating criteria, such as sample size and blinding, together with methodological considerations which were specific to menu labeling, like the extent to which menu labeling was implemented or the percentage of participants noticing menu labeling during the interventions. Studies measuring differences in energy consumed were rated highly, as we assumed they most accurately reflected the effects of menu labeling. Studies measuring energy orders did not take into account the portion of the meal left uneaten, and studies measuring differences in hypothetical selection neglected the social and environmental aspects of eating and were therefore awarded fewer points. Noticing menu labeling was important, as calorie counts cannot affect choices if they are not seen, and their effects can only be properly measured if all menu items are consistently labeled to fully inform all choices. High noticing rates and explicit mentioning of complete labeling therefore improved the quality of the studies according to our rating scheme.
Overall, almost 18,000 participants spanning 3 countries were included in this review. The studies varied greatly in design, and through the rating process just described, we classified 3 good quality studies, 9 fair, and 3 weak. We'll now present our results and discuss them briefly at the same time. Well over half the studies reported statistically significant reductions in energy consumed, ordered, or selected when participants were provided with various menu labeling formats, while 3 studies resulted in some reductions depending on the menu labeling format or type of establishment, and only 3 studies had no effect at all. It was interesting to see that all 3 studies assessing the effects of menu labeling on energy consumed resulted in significant energy reductions, and we argue of the 3 outcomes, this is the ultimate measure of the effects of menu labeling, since disclosing calories may encourage people to eat less. 3 of the 6 studies assessing the effects of menu labeling on energy ordered resulted in overall significant energy reductions, and half the studies assessing energy selected resulted in overall energy reductions. Menu labeling was effective in a variety of food service outlets in both real-world and experimental settings. What's encouraging about these results is it's the first review to find that menu labeling is effective in the real world. 2 previous reviews from 2013 and 2015 both found that significant energy reductions were limited to experimental settings. Most of the studies included in our review were based on typical fast food menus, and the majority of these resulted in statistically significant reductions. And this is very encouraging given the frequent consumption of fast food. 8 of the studies reported on the rate of noticing energy information on menus. Except in one case, menu labeling had no significant impact where less than 70% of the participants noticed the information. It may be that low noticing rates reflected poor menu design, where calorie counts were obscured or otherwise overlooked. It could also reflect customers who are unfamiliar with menu labeling and who don't understand the relevance of the information. In contrast, 5 of the 6 studies, where at least 70% noticed menu labeling, resulted in significant energy reductions. It may be that repeated exposure is needed for consumers to notice, understand, and use menu labeling. And this notion is demonstrated by studies collecting multiple sets of post-labeling data. Menu labeling had only a marginal effect at 6 months, but significant energy reductions were detected after 18 months. While the format of menu labeling, which we're about to discuss, was once proposed to be a possible explanation for mixed results, we suggest the level of visibility or noticeability of menu labeling is equally important. A number of studies tested the effects of menu labeling formats offering interpretive guidance, and the most commonly tested was traffic lights, which use color coding to show if menu items are low, medium, or high in energy value. Traffic lights enhance the noticeability of menu labeling and facilitated comprehension, but in only 1 of 5 incidences did it significantly outperform plain calorie labeling. And this could reflect other studies that show people consider traffic light coding to be too coercive or directive, which may ultimately deter its use. While multiple traffic lights, pictured here in the bottom right-hand corner, seem to confuse consumers or provide too much information, particularly in dining settings or where fast food choices are made relatively quickly. Another type of interpretive guidance used is physical activity equivalent, presenting the energy information in terms of how much activity is required to expend the energy of a menu item. All 3 studies using physical activity equivalents resulted in significant energy reductions, and more times than not, it was more effective than just plain calorie labeling. Participants seemed to respond well to the framing of the energy information in terms of energy consumption and expenditure. An attitudinal study provides a great example of where a difference of 60 calories was considered trivial, whereas an extra 20 minutes of walking prompted more careful consideration of the menu items. However, physical activity equivalents are more often popular with younger people and those of normal weight, whereas it might be considered irrelevant by the elderly or those who do not regularly do the illustrated exercise. As mentioned earlier, reference values offer contextual guidance. 5 studies specifically used reference values, though with no consistent outcome of its effects. The one study that compared menu labeling with menu labeling and reference values showed that the reference values increased the effects of menu labeling, and this finding is supported by a meta-analysis which showed that reference values had to accompany menu labeling for the reductions in energy to be significant. Our results gave no indication that variances in BMI, ethnicity, age, or socioeconomic status have any particular influence on the degree of effectiveness of menu labeling. The effects of menu labeling are no longer exclusive to females or those from higher FES or of normal weight. Menu labeling could be considered an equitable initiative, as more recent studies show that calories on menus can positively influence males, overweight individuals, and those from lower socioeconomic status.
We also thought it was relevant to conduct a meta-analysis of the studies included. We could only use 12 studies for the meta-analysis, as it was not possible to obtain the necessary data for all of the 15 studies. The analysis conducted compared controls, meaning conditions with no labels, versus interventions presenting energy labels alone. We narrowed the meta-analysis to this type of menu labeling format because it was common to all the studies included in this review. But we did not have enough studies with other menu labeling formats, like physical activity equivalents or traffic lights, to conduct meta-analysis with that kind of focus alone. The meta-analysis showed that the effect of menu labeling was statistically significant for all outcomes measured. No publication bias was detected. For studies measuring energy consumption, the overall estimated effect of menu labeling was a mean reduction of 100 calories, as you can see in this picture. Putting this into context, some researchers have suggested that reductions as small as 50 calories per restaurant visit could avert weight gain in the long run. A couple of Canadian researchers even calculated that reductions of 130 calories twice a week could prevent the gain of 3.7 kilograms over the course of 1 year. At a population level, these small reductions can then be rather meaningful. At the same time, we should point out a limitation of our analysis, since only 3 studies are included here. This is a limited amount of data, and in the future we hope more research on the effects of menu labeling in energy consumption is published, since this would permit us to perform a broader meta-analysis. Of course, reliable methods for measuring energy consumption are more intrusive and costly, so it might be some time before enough good quality studies are available for a follow-up analysis. Additionally, studies measuring only consumption of energy in a single meal do not allow us to rule out possible compensatory energy consumption behavior in subsequent meals. For studies measuring energy ordered conducted in real-world settings, the effect of menu labeling was estimated to be a mean reduction of 78 calories. But only 5 studies are included in this meta-analysis, and there was statistically significant heterogeneity between them, with one of the studies included even being classified as weak. We also performed an analysis with energy ordered where we included all studies looking at this outcome, both the previous 5 studies from real-world settings and 2 more studies from experimental settings. And as you can see on this picture, when studies conducted in experimental settings were included, menu labeling reduced the overall mean energy ordered by an estimated 75 calories. So a reduction of the same order as for the previous meta-analysis, the one that only included real-world studies. Even though the amount of calories ordered is not as direct an indication of the amount people will actually consume, reductions in energy ordered provide valuable information in the sense that energy consumption is limited by the amount of energy ordered. And in the end, it might lead patrons to, actually consume less energy. So we think this is still a meaningful result. In the same way, the amount of calories selected is not as direct an indication of the amount people will actually consume, but in the end, it might also lead patrons to consume less energy. We included studies that assess the energy selected because this type of studies allows for better control of variables like menu labeling formats, items offered, prices, and portion sizes, and therefore can accurately capture the effect of menu labeling conditions versus the absence of menu labeling. Such study designs do not, however, so often take into account the strong influences of participants' preferences, hunger, society levels, or even the social and environmental context of the meal. And that is why these studies were rated lower than studies assessing energy consumed and studies assessing energy ordered. For studies assessing the effect of menu labeling on energy selected, the estimated effect was a mean reduction of 48 calories, with significant heterogeneity between studies. So actually a smaller decrease than the reductions observed for energy consumed and ordered, but still significant in terms of showing consumers' intent when selecting items from menus. We will now wrap up with a few comments on the strengths and limitations of our work. We could see in reviews prior to 2012 and from other sources that results for the efficacy of menu labeling were mixed, and researchers have proposed that such results could partly be explained by consumers not noticing or even understanding the inclusion of energy values on menus, or by the lack of compliance from the industry and ineffective labeling formats or limited consumer exposure to menu labeling. That is why we decided to focus exclusively on articles published in very recent years, and despite the narrow time period, 15 articles still met the inclusion criteria, showing that the subject is still in focus among researchers. This way, we tried to capture results that more accurately reflect consumers' response to menu labeling as they grow accustomed to the initiative and as industry adaptation to legislation is more widespread and compliant, like I also mentioned earlier. We also think this constraint in our review design better reflects the evolution and progressive improvements in menu labeling formats and implementation. Of course, this limited scope can introduce a bias, whereby only studies with positive results have been submitted and accepted for publication in more recent years, and therefore found their way into this review. We see another strength in the inclusion of 7 real-world studies. It could be argued that results from real-world settings provide the strongest evidence of the effectiveness of menu labeling, since experimental settings cannot accurately reflect the complexity of the eating-out environment. So even though we included studies from experimental settings in the review, the rating criteria scheme we developed awarded this type of setting fewer points compared with real-world studies, as I also mentioned previously. Also, the analysis of results was independent for both setting types. Furthermore, the meta-analysis conducted showed that menu labeling is effective for both energy consumed, ordered, and selected, and it also showed that menu labeling is effective for energy ordered in real-world settings. A clear limitation of our review, as well as previous ones, and common to meta-analysis, is that several of the included studies had methodological shortcomings, such as incomplete menu labeling, medium or small sample sizes, lack of case control match, statistically significant differences between comparison groups that were not adjusted for or not even reported. Only 3 studies were rated as good quality studies. Also, as I mentioned earlier, only 3 studies are included in the meta-analysis for energy consumed, and only 5 studies for the meta-analysis of real-world settings, so the data is limited. Last but not least, even though no publication bias was detected, these tests are generally underpowered, and as such, publication bias might have existed but not been detected.
So our takeaway message for today is that menu labeling is effective in reducing energy ordered and consumed in real-world settings, and it is effective in various types of food service outlets, positively affecting a large proportion of the population. Our research strengthens the evidence that prolonged, prominent, and noticeable labeling of all menu items with reference values is important to effectively increase menu labeling use. As the eating out environment increasingly contributes to a larger proportion of total energy intake, providing energy information at the point of purchase is essential for consumers to make informed food choices. We therefore believe that menu labeling should be considered an important tool in overweight and obesity prevention. And that concludes our presentation. Thank you very much for listening. We'll hand it back to Olivia.
Thank you very much, Jodie and Sofia. That was a great presentation, especially in an introduction to the relevance of the issue and then going through the evidence was very well done. We really appreciate you presenting this today. So we have a few more polling questions for the end of the session, and then we'll get into some of the questions that participants have begun to post in the chat section. So before we get into that, we're going to go back to the question that we had actually posed before the session, which is the same statement of menu labeling can reduce energy ordered and consumed in the away-from-home food environment. So again, just select your responses in WebEx and click Submit when you have responded. So for Jodie and Sofia, we've had a few questions in our chat section, and just a reminder to all of our participants, you can start posting your questions in the chat section, and we'll read those aloud to our presenters. So we had one question first, which relates to the showing the physical activity on the menu. So one of the questions was, do you think it is dangerous to see physical activity as only a way to burn calories, and that this may make physical activity appear as demanding and negative and only a way to just burn calories instead of engaging in physical activity for the sake of physical activity?
I don't necessarily think so, mostly because with the research they've done on physical activity equivalents, they tend to use walking as an example because most people do this every day. They've found if there's other activities such as either swimming or running, that excludes a lot of the participants from taking notice or being able to put that into the context of what they do if they don't engage in that activity. So I don't think it's dangerous. I wouldn't necessarily recommend it going on the menus, but it's really helpful in leading up to implementation. If there is information going out to the public to support implementation, it's really useful in that arena.
And at the same time, we also noticed in some of the studies we used in our review that physical activity equivalence was actually more useful in making consumers noticed that there was something extra on the menu, so making them aware that there was some labeling. So I agree with Jodie. We don't think it's dangerous as such, but it might enhance visibility.
Yeah.
And of course, if in that case, it should be with activity types that people can relate to, such as walking, like you mentioned, Jodie.
Yeah, and in one of the studies, they also said it actually heightened comprehension of the information as well. So that has to be taken into account, I think.
That's interesting. That's very great. Thank you. We have another question from April who's wondering if you have any information regarding the cost associated with implementing a menu labeling policy within a country.
There is some articles that we've come across. Generally, it's initiating the process that's more expensive, where people have to analyse the food that they've got on their menu boards. Menu labelling generally applies to chain restaurants, and a lot of these chains, when they're serving standardised foods, they already have this information anyway. So that eliminates a lot of the cost. And also then the other cost is associated with actually updating their menu boards or their menus, how they present the information. But it seems to be quite negligible. If we compare the price and then the outcomes, if it does have a good outcome of reducing overweight and obesity, then it's an effective way of doing it, a cost-effective way of doing it.
Yeah, I would also just like to add, here in Denmark, in the Danish Cancer Society, we were involved in a work where we developed some guidelines because we believe this is an effective tool and should be part of the initiatives in Denmark to prevent overweight. So we started a lobbying work after this, and we made these guidelines. We developed this kind of guidelines for the industry in cooperation with the industry. And like Jodie said, most of the information, most of the high cost of this kind of change would be associated with the calculations of energy content and so on. And most chains already have that information. So we actually proposed that they should voluntarily start changing their menu boards, but of course in a tempo that would fit eventual changes and not something that had to be done immediately. So, yeah.
That's great, thank you. Yes, it would be really great to see some restaurants taking on this even voluntarily, as you mentioned. So we have another question from an attendee who's asking if menu labeling brings the responsibility of the obesity endemic to the individuals. And I'm assuming that's as opposed to as a population or public health general issue.
Well, the assumption that obesity and overweight is a personal responsibility exists to a high degree anyway. It's an argument that I've heard some governments use. It's an argument that even individuals, there was a poll done here in Denmark, and 80% of the people actually believe that obesity is a personal responsibility. And it's also an argument that the industry used. So it exists anyway as a personal responsibility. So we argue if it is in that light, then why not provide the information where people can actually make informed food choices? I don't think it necessarily puts the burden on the individual, though. In any case, if there is any food reformulation done, that averts the personal responsibility. Some of the choices actually reduce the calories without the person having to take that initiative to do it themselves.
Well, actually, I believe it doesn't really put the responsibility, alone on the individuals, because it puts a lot of responsibility on the companies as well, and the chains. They are exposing and disclosing. That's what I meant. The energy content of their products. And that can also be an awakening, sort of wake-up call for themselves and, like Jodie said, lead to some reformulation. So I think it's, of course, I like to believe it's more of an education tool for the consumer, that it helps the consumers realize how much energy there is in the food we eat outside of our homes, because there is much more than in the food we eat in our homes. We prepare ourselves in our homes. And as such, I don't think it puts the responsibility on the individual alone, but it might be a sort of, you know, part, sort of shared result, if we could say that, I don't know. Yeah, I hope it makes sense what we're trying to say.
Yes, that's really great, and I appreciate your response, especially bringing in the idea that it shares responsibility with the restaurant as well, so that's great. So we have another question here, which has actually come up in the Canadian news relevant to menu labeling. So the question is, have you looked at studies about the effects of menu labeling on eating disorders? Perhaps it would induce the likelihood of eating disorders.
There has actually been a number of studies on this. Again, not with concrete evidence to suggest that if people have eating disorders, that it's going to help them eat less. We tend to find what they found was if people have eating disorders, then they tend not to eat at the food establishments that serve particularly high energy food. And if they have eating disorders, many of them actually would use the internet or other sources to find the energy content before going to certain places. So there's not conclusive or strong evidence to suggest that it adds to eating disorders.
But there at the same time, there's actually a lack of evidence on the subject. That's my feeling of it. We haven't looked at it, you know, we haven't posed that research question, you know, to work with it ourselves. But we came across some of the studies, and yeah, I agree with Jodie. The evidence is inconclusive, and like she said, it seems that people who tend to have eating disorders will actually take steps in order to find out what they will eat and where they will eat before getting to the establishment. So, yeah.
That's great, thank you. I think it'll be interesting to see how that evidence unfolds in the future. So there's a few more questions. So in this particular systematic review, it was shown that menu labeling was successful in reducing calories. But do you look at any other aspects of how this affects or improves overall health?
We didn't have specific research questions in that area, so we didn't look at that. Unfortunately, it's a very interesting question. Maybe we'll take a look at it in the future, but so far we don't have anything on that.
I have read some commentaries about it. They're saying one of the great risks they believe of menu labeling is if the food service industry is focused on reducing calories on some of their calorific menu items, it may not necessarily improve the overall healthfulness of that menu item. And that is a risk. I mean, they could be taking out fat and adding sugar, for example. And also, we gave an example before where a regular burger and a salad basically have the same amount of calories in there. And the calories alone simply do not indicate if one menu item is more healthful than another. But in terms of overweight and obesity, of course, we're just looking at calorie contents, and that, I mean, that is what we really need to fight at the moment. And there is no one silver bullet for overweight and obesity. Nothing's worked up to date. So in respect of addressing overweight and obesity, I still think it is very relevant.
That's great. Thank you for your response on some of those other questions as well. So there's another question from an attendee who's asking if you got a sense that restaurants were being honest in the reporting of calories, especially once they see the sales of items that might be affected. And maybe another question with that is even, are there any sort of rules or regulations that would keep restaurants being honest about posting calories?
I don't know that much about it, but I have read a little bit about the Australian context, and they are actually checked to make sure that the calories that are posted are accurate. It's random testing. And the second part of the question was rules.
Yeah, can we have that one again? Yeah.
So just if there's any rules or regulations that are put in place, I guess, for any countries that have made this change in legislation.
Rules regarding reporting of calories, or rules regarding?
Reporting or honest reporting of calories.
Oh, yeah.
Yeah, well, as, in Australia they have, companies are fined if they don't comply with the regulation, and this includes fines for improper reporting of calories if they fall without the 10%, I think there's a leeway of about 10%. So if a product was labelled for 500 calories, then if it contained 550, that would be considered acceptable. It wouldn't be breaking the regulation.
That's interesting, thank you. So another attendee, kind of going back to the cost question, they're wondering if you're aware of the costs or time that's required for the development and enforcement of a legislation requiring menu labeling. So maybe less on the restaurant end, but more on the government end.
Oh, well, I mean, we can just take the US as an example. How long has this process taken? It all started back in, I think, in 2002, and everyone's really struggled to get it in place, even though regulation and certain dates have been set, they've always been delayed. So I think it varies from country to country. I guess it also depends on how strong the food service industry is with it. It also depends on political will. In New South Wales, they actually brought in sweeping changes. Menu labelling was introduced relatively quickly. I think companies had, from the time it was first talked about to the time it was in place was about 6 months, and then companies had 1 year to be fully compliant. But because of these sweeping changes, the government also provided a lot of support for companies to be able to implement. So if they had any problems with how to display their calories or how to just comply with the regulation, there was a lot of support from the government. So after the full year, the initial year of implementation, there was 100% compliance. So it contrasts from country to country.
Yeah, but as to the cost, we have no idea. That's legislation, and it's not part of our expertise.
I haven't even seen numbers on it.
Yeah, but this is also why here in Denmark we believe more in a voluntary implementation of this type of guidelines for menu labeling, because of course legislation takes a long time to implement, and of course it also requires follow-ups on the compliance of the food industry. And just like Jodie mentioned, and at the same time, we see from a few countries, like for instance, the UK, they implemented it as a voluntary agreement among the food industry, and it seems to work really fine. So maybe that's a good alternative to the costly legislation, both in time and resources.
That's great, thank you. So just in the interest of time, I'm going to move along the slides here for our participants and open up a few more polling questions that we have. And in the meantime, Sofia and Jodie, I'll just pose a few more questions. We have really great questions from participants today. So another individual is asking if you've seen any evidence regarding restaurants actually changing their own menus in response to consumer demand for food items with fewer calories.
We actually have seen that. There was a lot of good evidence actually from the UK, especially with sit-down restaurants or table service restaurants. We actually found that restaurant owners were surprised when they did the assessment of how many calories were in their menu items, and due to the shock of how high the calorie content was, they actually reformulated a lot of their meals. Either changing cooking methods, but a lot of times it was simply reducing portion sizes. So there was a strong reaction from the restaurant industry in the UK addressing changes. And it's hard to say what, there's a couple of examples also from the US about reformulation with some of the major takeaway chains or fast food chains. But it's hard to say whether this was directly responsible because of menu labeling or some other reason. They say it's due to consumer demand, but yeah, just changing default milk at Starbucks, for example, saved a lot of calories overall over the period of a year. And there is a lot of evidence that it has happened, but it's difficult to actually be certain that it was as a result of menu labeling or if it just coincided at the same time, around the same time as menu labeling.
That's great and interesting to see how that might unfold in the next couple of years as well as legislation begins to change in more countries. So I've just changed to our final polling question on the slide. And another question from an attendee who's asking if the significant effect is due to increased awareness, what public health strategies would be needed to help raise awareness of calorie menu labeling?
Well, that's one of the things we postulate from the evidence we looked at, that it does seem to be very, very important that consumers notice menu labeling so that they then can understand menu labeling. And of course, in understanding menu labeling, we also mean that they need some help. So campaigns, information campaigns should probably also be ruled out at the same time as menu labeling is implemented, or otherwise we think there will still be a number of consumers that might not get the most out of it. So of course, understanding what you're seeing is important. Yeah, I hope that was an answer to it. Do you have anything to add?
I was just going to mention again the study that they did in Australia when they implemented there. They did take some baseline measurements of people's understanding of how many calories they needed a day. They also asked people if they had any idea of how many calories were in some of their menu items. And they repeated the study after, I think it was 6 months, and then again at 1.5 years. And I think that's really important. If you're doing a public health campaign, you need some kind of baseline study so you can really measure the effects to see if consumers are becoming more aware, if they have a good understanding of what energy values really mean. And I know that in Australia they did spend a lot of money on social marketing, and I think that was in response to a lot of bad press in the States, delayed implementation, et cetera, I think instead of waiting for the media to get hold of menu labeling, it was the government who took on a big social marketing campaign to get people on side from the start, and I think that was a very smart strategy, actually.
That's great, thank you. I think it's definitely an aspect that sometimes gets overlooked with changes in regulation, so going on to those public health strategies, that's really important to hear. So maybe just one last question, which might be fitting for the day, is do you anticipate repeating this systematic review in a couple of years?
We would very, very much like to do that. Of course, that means that it requires that we find new studies, but we do hope to have the resources to do a follow-up of this analysis and this review in a few years. That's what we wrote there, and we're looking forward to that possibility in maybe a couple of years. So far, I am working on a report on an update of the evidence right now, and there are a few new studies, but not as many as one would expect or would like to find. But you know how research is. It's time-consuming, and publication is also time-consuming, so we know this kind of updates will be relevant in a few more years. So we hope so.
Certainly, that's great. I think we'll definitely keep an eye out on our end, and many people who would be interested in seeing an update in a couple of years as this unfolds. So with that, I think we've about reached the end of our questions and the end of our time for our session. I'd like to give, again, a big thank you to our presenters, Sofia and Jodie, for a great presentation today. and going through all of the many questions. Really appreciate you and everyone for posting questions and making this certainly a very engaging and stimulating session. So just a reminder to all of our participants that a copy of the presentation, so the audio recording, as well as the PowerPoint slides will be posted online by the end of the week, so we'll make sure those media resources are available. And so thank you everyone for joining us today. Sofia and Jodie, if you have any final words.
I would just like to say very much thank you for inviting us to participate in this webinar. It was a pleasure to present some of our results and considerations. And we're looking forward to eventually looking at the poll results, whether it helped people and whether they believe that it changed their perspectives on this subject. Do you have anything else you want to add, Jodie?
Only to say thank you very much, Olivia, and thank you everyone who listened.
Thank you very much, and good afternoon, everyone. Thank you for joining.